You can always donate via our website. And all of our recordings for this program, as well as past speaker series, will be on our elenaslight.org website as well. So to introduce myself, my name is Yasmin Abid, and I'm the Program Development Coordinator here at Elena's Light. And I've worked with them for about a year now and have had the pleasure to really get to know this community and have just really come to love Foreshte and the space that we've really developed here. And I just hope to continue to be part of this. And it's so great that everyone here in the audience, on the live audience, as well as the Zoom audience has, that same passion for what we're trying to do. So today I'm very excited to speak with Dr. Kaveh Khoshnood. And we're going to talk about his work in the public health space and humanitarian conflicts, and we'll get to know him a little bit. So I'm very excited for tonight's event.
All right, thank you, Yasmin. Hello, everybody. My name is Samira Akbarzada, and I'm the brand new grants manager for Elena's Light. I recently joined my new position earlier this month, so I'm very happy to be here. Tonight, we have the honor of speaking with our very distinguished guest, Dr. Kaveh Khoshnood, who's an associate professor and director of undergraduate studies at the Yale School of Public Health and an executive committee member of the Yale Council on Middle East Studies. Throughout his tremendously impressive academic career, Dr. Khoshnood has more than 2 decades of domestic and international experience in HIV prevention research among drug users and other at-risk populations. He has also been actively engaged with several research projects focused primarily on the health issues of conflict-affected populations and in humanitarian settings with the focus on the Middle East and the North African region, including Lebanon, Syria, Iraqi Kurdistan, Iran, Afghanistan, as well as Somalia and Sudan. One example is his amazing cancer prevention research projects with conflict-affected populations in Lebanon, Turkey, and Somalia. So it's no secret that Dr. Khoshnood is committed to strengthening public health education and research capacity in low middle income countries, particularly those affected by conflict. And I personally am very honored to not only introduce him, but speak with him tonight because I was very fortunate to have him as my professor while I was a grad student at Yale. So thank you so much, Professor Khoshnood, for joining us. We know how valuable your time is. And also thank you to our audience, both who are here in person and online in Zoom. So I'm gonna give it back to Yasmin.
Thank you. So, Dr. Kaveh, you served on the board of IRIS, and you also have strong connections with Elena's Light. Hence, you've had firsthand experience with the population, the refugee population, and you understand the specific challenges that refugees face when they're resettling in a new community or in a new country. Can you tell us a little bit about your experience and what your thoughts are on the current humanitarian crisis in Afghanistan, and how are organizations like Elena's Light helping Afghan evacuees resettle in New Haven, and how can we as citizens of New Haven or other communities really just help organizations like Elena's Light work with refugees?
Thank you so much. Can you hear me? Thank you for the kind introduction, and it's really a pleasure to be here with all of you in person and in Zoom. Yes, I served on the board of IRIS, the Integrated Refugee and Immigrant Services, for about 10 years, and my term ended a few months ago. And I learned a lot, frankly, from being on the board. As you said, I mean, when refugees are being resettled in the United States, the main goal here is to integrate them into the community. And that's not an easy task. They're coming from very different cultures. They may not have some of the language skills, cultural skills, etc., to get integrated. So they need some support to be well integrated. And I think IRIS does a good job to try to do that. And one of the ways in which they do that is by having community co-sponsorship, which is rather unique compared to other refugee resettlement agencies throughout the United States that I know about, where it's very much sort of focused just on the organization. But what IRIS does, they partner with communities. Sometimes there are church groups, synagogues, etc. But they kind of want to support. And there is a lot of advantages in doing that. First of all, it reduces the level of burden from organizations. But I think the other important thing is it's makes it much more easier to integrate the refugees into the community. They get to know each other. The children get to know each other. The parents get to know each other. And I think that's huge. And it changes the narrative. As you probably know, sometimes there's a lot of negative sort of narratives about refugees or just immigrants in general. And we need to, that's one of the things we need to do. And I think Elena's light, to my knowledge, is also doing exactly that. And the fact that it's being led by someone like Ferishte Ganjabi, who herself came as a refugee to this country, that makes a tremendous difference. I think it begins to really change the narrative about who refugees are. And we begin to see people like Farishta making contributions to our community. They're not just here to burden us, they're here to add and contribute to our community. So there's a lot that I've learned and I appreciate about the work that Iris does, the work that Elena's Light do.
Okay, thank you. So right now, there's a focus on the situation in Afghanistan. And for me, this is very personal because my family were also refugees from Afghanistan who resettled in the US in the early 90s. So Professor Khoshnood, can you tell us more about the Scholars at Risk program and what you are hoping it can accomplish at Yale?
Yeah, that's a good question. As you mentioned, there is a Scholars at Risk network throughout academic institutions in the United States, but also in Europe, where they are able to host scholars who can no longer continue their research, their teaching. And frankly, some of them are at risk of arrest or execution, etc. And that includes, if you think of Afghan women who were teaching at the American University in Kabul, they're no longer able to do that. And some of them, their lives are in danger. So universities in the United States need to step up and host these scholars. And frankly, our students and our faculty will benefit enormously from them. We are not only are helping them, we are helping our own students and faculty. Yale has been sponsoring and hosting several scholars at risk from various countries, including Afghanistan. But to my knowledge, Yale does not have a robust, well-structured program. A couple other universities do. I know Harvard University, when you look at their website, you see scholars at this program. It's been going on for well over a decade, and they're able to host many scholars every year. So I think our academic institutions should step up and do that. And this is a conversation that I'm having with some colleagues at Yale who are very, very supportive of this. And I think the situation in Afghanistan has increased the urgency for this. We've got to open up our doors for these scholars.
So going off on that question, how do you think universities such as Yale can help refugee resettlement here in New Haven as well as the greater Connecticut region?
Refugee resettlement organizations such as IRIS, they do a tremendous job to help resettled refugees get jobs, their children to go to school, get access to healthcare, but they have limited funding and support to do beyond that. So for example, if there's a young Afghan who's arrived here the last couple of months and is passionate about becoming a doctor or nurse, that's really beyond the capacity of refugee resettlement agencies to support the kind of the career track of somebody like that. That's where I feel like universities should step up. We can provide some educational support, training, mentorship for a young Afghan, Syrian, Iraqi person who's now here in New Haven and they want to be a doctor and they need a lot of support. And that's, frankly, like as I said, I think it's beyond the capacity of these resettlement agencies. They can't spend hours and hours and all it takes to help them with their examination, with their course, collecting their courses, etc. And that's where we can do something about that.
So to kind of like shift gears a little bit and talk about like your own research, you've engaged in a lot of like extensive research and public health interventions in conflict affected areas. What made you interested in the health of populations affected by humanitarian crises? And could you sort of like define what is meant by a humanitarian crisis?
Well, I was born in Iran. And when I was a teenager, Iran went through a major revolution, a political revolution. I think many of you probably know about this. In 1979, the government of Iran collapsed and a new government took over the Islamic Republic. That led to violations of human rights, extensive human right violations, political violence, and then the Iran-Iraq War started in 1980, which lasted 8 years. Over 1 million people died. Again, I was a teen. I was too young, so thankfully I was not forced to go serve in the military and fight in a war that I didn't believe in. But I experienced the trauma and all the damage that a war inflicts on large populations. And it kind of stayed with me. I left the country in 1982, and I was fortunate to be able to come to the United States. My uncle supported my stay here, going to college, etc. And that kind of stayed with me in my sort of back of my mind. And honestly, I was sort of trying to forget about all that happened in our country. But when I became a faculty member at the Yale School of Public Health, I started thinking about, as public health professionals, what should we do? A war conflict is not something that we can ignore. It has major consequences for population health. And in public health, we are focused on prevention. So when it comes to war and conflict, what can we do? We are not clinicians, so we're not able to go and repair the wounds and injuries of individuals. That's not what we can do. But what is it that we can do? That question kind of stayed with me, and frankly, I'm still thinking about that. But I have come across some skills that we have, some competencies, skills that we have that we can bring into this topic. In public health, we think about primary prevention, which is how can we prevent a bad thing from happening in the first place? When it comes to war and conflict, primary prevention is a complicated issue. And frankly, it's beyond the scope of what public health people can do. Because when you think of why wars, civil conflict happens, there's political dimension to it. There's all kinds of deep issues that are beyond what we can do. However, I still think there's things we can do. But in public health, we also think about secondary prevention and tertiary prevention. In secondary prevention, we think about if a bad thing happens, how can we contain it? How can we prevent it from becoming worse? And I feel like public health people have been contributing to secondary prevention. Um, and then tertiary prevention is an example of that would be, think of child soldiers. You may know in many countries and regions around the world, children are basically forced to serve in the militaries and get involved in war and conflict. And imagine if a child became a child soldier from age 9 to 15, and then the war ended. That child can't go right back to a normal life, live with the community, continue his schooling, her schooling, etc. That child is going to need a lot of support. And that is like an example of tertiary prevention, rehabilitation, helping them go back to their society. So public health folks do have a lot of skills. We do have a lot of competencies, but frankly, it's been somewhat ignored, I would say. When I looked at schools of public health in the United States, only a handful I see that have some sort of a program that deals with a war conflict and its consequences of what we can do. So I kind of have a personal interest on this topic. And I must say there are students such as yourself, Samira, who have a passion and interest in this. Some of them are thinking about kind of working in the humanitarian sector, whether working for a UN agency, Doctors Without Borders, International Rescue Committee. That's the career path. And I feel like we should do our best to prepare them for that kind of a career opportunity. The humanitarian world needs professional development and skills. You know, just wanting to do good is not enough. There's skills that are needed. And I feel like that's where our school needs to do what it can to prepare those students to go into that career. I'm not sure if I answered your question, but.
So staying on the topic of conflict and war, what are some of the challenges of conducting health research with populations affected particularly by armed conflict? So looking at the example of Afghanistan, which has been in crisis for many years, can you tell us what your research has uncovered?
Yeah, I mean, the idea of doing research in humanitarian setting is complicated. And one of the first things we need to think about is what are the priorities on the ground? What is it that people need? It can't be about what I'm curious about, you know, what topic comes to my mind sitting in my office in New Haven, Connecticut. That's not the way it's going to work. I need to partner with organizations on the ground and people on the ground who have been affected by conflict and see what their needs are. As you mentioned in my biography, I mean, I have a long interest in HIV/AIDS prevention. And when I went to Lebanon, a country that has gone through multiple crises, I asked the question, is HIV/AIDS and substance abuse, which is related to HIV/AIDS sometimes, is that a problem among displaced population in the country? And I got a mix of answers. Some of them said, well, nobody has done research on this. We don't know. But then some of them told me that, frankly, yeah, we don't know anything about this, but there was some hesitation to do research on a topic that is very sensitive, right? So in public health, we like to think that if we shine a light on a problem, it leads to good things happening. If we demonstrate that refugees that are resettled in Connecticut or uh, people who are, you know, in transition in Lebanon, if we demonstrate that, let's say, substance abuse is one of the problems they're struggling with, we like to think that the governments, the humanitarian organizations are going to respond to that evidence, that data that we produce. That's not always the case. Unfortunately, sometimes politicians, policymakers who have anti-immigrant, anti-refugee belief perspective, they may use that data to kind of say something negative. Oh, they're bringing drugs problem into our country. They're bringing infectious disease into our country. So doing research in humanitarian setting has a lot of ethical considerations that we have to take very, very seriously and make sure that the research that we do leads to positive things for the community and not the last thing we want to do is burden them more because of the research we've done. So it's a topic that I try to talk to my students as well who have an interest in doing research in humanitarian settings.
So moving to Iran, which is your country of birth, what humanitarian conditions affect the health of the population there? And I know you talked a little bit about like how data can be sort of like misconstrued. Do you mind kind of talking a little bit more about how you personally confront that, or public health personnel, how do they sort of like, what's the strategy to make sure that the data isn't being misconstrued?
Yeah. So as I mentioned, I left Iran in '82 and I didn't go back for about 20 years. And I went back for a short visit when I had an opportunity to do that in a relatively safe way. So I've done limited research in Iran and have done it remotely in partnership with people on the ground. I was amazed when I learned that there are people who are doing substance use, HIV/AIDS related research with the Iranian community, but also with Afghans. There's been a lot of Afghans on, and unfortunately, some of them struggled with substance abuse, either because that was something they were exposed to in Afghanistan or they got exposed to that problem in Iran. So I've done some research in collaboration with colleagues in Iran, but with changes in the political structure in Iran, some of my colleagues literally said, we can't do this research anymore. It's politically problematic. And I'm like, look, the last thing I want to do is get you in trouble. So that's fine. We kind of had to pause things. So again, it's complicated, but we really need people on the ground who understand the political situation, the cultural context, the needs on the ground. That's sort of my number one thing. I'm not going to impose a research topic that just interests me. That's just inappropriate to do that. There was a second question you asked.
Just in general, like what are some of the humanitarian conditions in Iran that have really been affecting the health of the population?
Yeah, I mean, I mentioned briefly. I mean, the war, obviously, that 8-year war, 1980 to 1988, was absolutely devastating. It was one of the largest wars in decades. Actually, there was a public health student, Iranian American, many years ago, who really had a passion for understanding what are the mental health consequences of exposure to war. And I ended up helping her do a research project where uh, she wanted to know what are the long-term mental health consequences of being exposed to chemical weapons, because the Iraqi government bombed used chemical weapons against civilians in Iran, especially in the Kurdish region. So thousands and thousands of people got exposed to these chemical weapons, and they had all kinds of sort of clinical consequences. So she did this study which looked at mental health consequences of exposure to chemical weapons 17 years post-war. And no such study had been done in the past. So she literally did this whole study over the summer. She got a fellowship from Yale, just a couple of $1,000s. This study ended up not only becoming her thesis, it informed the clinicians on the ground. They did not think that PTSD, depression, anxiety disorders, etc., they're still going on in communities that were exposed 17 years ago to war. They just had no data. So her data was very impactful on the ground. Ended up getting published in JAMA, which is a very top tier journal. And it was used, I was told that against Saddam Hussein, uh, that data literally was used as one of the evidence against sort of what he had done. So it's just kind of the fact that a student led a project with a few $1,000 fellowship, which was mostly for her to travel to Iran and back, and have such an impact, really inspired me. So I've been working with a large number of students since then. Uh, by the way, most of whom are either coming from a refugee family situation themselves or they're immigrants. So they have a kind of a personal interest and passion about this. And they've done remarkable things. So I'm happy to talk to you about.
Um, so Lebanon is a country that has been going through a deep economic, political, and infrastructural crisis recently. What do you find are the most like immediate health concerns or public health concerns there?
Um, you said Lebanon, has a pretty fragile government. Its healthcare system is not great. It's not very strong. So Lebanese population themselves don't have good access to strong healthcare. There's not, health insurance available to everybody. So Lebanon is burdened by itself. And now you have, a country of 5 to 6 million people you have another million Syrians displaced and enter Lebanon. Imagine that 1 out of every 4 person walking around Lebanon is a refugee. It's somebody who moved mostly all from Syria. So the burden on healthcare, the burden on education system is enormous. Um, Now, humanitarian organizations, there are a large number of humanitarian organizations, both on the ground, local and international, are there to support. But one of the things I realized is most of them are very much focused on sort of acute issues. Um, Infectious diseases, make sure kids are getting vaccinated, access to food, etc., which of course is hugely important. But we are talking about a conflict in Syria that's been going on over a decade. So there are Syrians in Lebanon who've been there over a decade. They have long-term health problems. So we talk about NCDs, non-communicable diseases. We talk about hypertension. We talk about diabetes. You mentioned cancer. I was really shocked when I talked to one of the non-governmental organization in Lebanon, where there was a Syrian doctor who was a cancer specialist, and he was displaced himself. He had to leave Syria, came to Lebanon, and he managed to work with a bunch of people to raise a little bit of money to do mammography and be able to do sort of breast cancer screening. And unfortunately, he found out that over 100 Syrian women were diagnosed with breast cancer, and he led that whole thing. And I was told that none of the organizations was focusing on like cancer prevention and cancer treatment. That's just outside of their priority list of humanitarian organization. It's like, that's not what we do. We are there on kind of limited time funding. And the government authorities, the Ministry of Health of Lebanon really doesn't have the capacity to do cancer prevention and treatment for this large population. So that became a topic of great interest to me, like what cancer prevention and treatment is very much neglected, overlooked by all the key actors. And ended up working with a Syrian American student from Yale, who was an undergraduate at the time, who went to Lebanon and did the first study of cancer knowledge, access to cancer treatment, etc., among Syrian population in Lebanon. And that study again was very impactful. That data was shared by all the actors, and now there was some actual evidence to make a case why they need to care about this topic. Um, so yeah, there's a lot going on in Lebanon, unfortunately, and it requires many different actors stepping up.
So my question was going to be on Syrian refugees, but you already touched base on that. So I'm going to shift gears a little. So since you are a professor of public health and I was an MPH student, I wanted to ask you, what advice do you have for people like me who have great passion for public health, but we also have a great passion for helping refugees? What professional, personal, academic advice would you give to other students like me moving forward? I know that's a very loaded question.
Well, I'm just thinking of the students that I have worked with. Usually the conversation is about, as we've been talking, there's a range of issues, right? In terms of health issues, mental health, all sorts of infectious diseases, non-communicable diseases, etc. So the conversation is about what is it that interests to you? Is there a particular health issue of interest to you? Are there particular populations of interest to you? Um, Children, adults, elderly, by the way, that's another hugely neglected topic. Healthcare for elderly who are displaced or are in a conflict situation. I haven't seen much work done, frankly, focus on the needs of the elderly. So I would say pick kind of an issue that you're most passionate about. because it's going to take a lot of work, a lot of commitment from you, and a very long term to have an impact. Um, that's usually how I start the conversation with the students and then figure out where they want to go. The project that I mentioned to you about sort of cancer care and treatment in Lebanon, but I worked with Jude Alawa, the undergraduate at the time, who's now a medical student in Stanford. I mean, he was very open to different topics, but we talked about it, and I mentioned how cancer care and treatment was very much neglected, and he said, okay, I want to do something about that. And then he started going into the literature, understanding it. But we're talking about the research, but there's also the educational needs, which is not a simple issue. I'm thinking of all the Afghan women right now, young women who are no longer able to continue their education. What can we do about that? Are there opportunities to reach out to them remotely using the incredible technologies that are out there to support their educational needs? The other thing is there's a lot of health profession students whose education has been disrupted due to conflict. A couple of years ago, we had a conversation with colleagues in Syria. These are medical students. Some of them were literally like 6 months short of completing their medical degree. And then conflict started. Their university was shut down, bombed in some cases. And they were so desperate to complete their education. And we had a conversation at the MacMillan Center about what can we do remotely to support them. And by the way, unfortunately, it's not just Syria. There are tens of thousands, if not hundreds of thousands of students, and I'm mostly focused on health profession students, who are studying nursing, medicine, maybe public health, and now their education has been disrupted. What are we going to do about that? That's a huge need. I've seen a little bit of projects in a few universities, but haven't seen like a consortium of universities in the US taking that major issue and figuring out how they can support. So there's a lot to do. And I think you have a lot of contribution to make. That chai, thank you.
Well, thank you so much, Dr. Khoshnood. Yeah, we're gonna move it to audience questions now. So you can just say it out loud and then I'll just kind of recount for this audience.
It's in the newspapers a lot is the food security in Afghanistan, especially among children and infants. It looks like a very complex crisis there. Is anything being done for them? And what's the capacity of the Taliban to put into place health, public health programs? And is there a role for international organizations? Is there a role for the United States to play in helping them get through this crisis? Huge issue. Absolutely. I saw the news. Was it about 1 million children in Afghanistan are going through food insecurity issues? Frankly, it's not a topic that I have worked on, but we definitely have colleagues at Yale who work on this topic. But in a conflict setting, that's a whole other issue. Um, I'm sure this is an important role for humanitarian organizations to play. And I'm hoping even the Taliban would be open to humanitarian organizations responding to this urgent need. But I really don't have much expertise on this particular topic. What are the health consequences for children that have food insecurity? As you can imagine, everything from their mental health to their physical health. Um, yeah, that's probably one of the most devastating things that could happen to children.
Are there any other audience questions or even from our Zoom audience as well?
Can someone monitor the chat for?
And the Zoom audience can't hear the question. So if anyone has a question, I'll just kind of like recap it for our Zoom audience and we'll go from there. Did you have a question? Okay, go ahead.
I know you came, you said that they really have six countries. I would like to learn a little bit more about your story. How was descending in the US, especially in the Haven? How you came up with the life that you have in your plan? Like what challenges you face yourself? What you do because many of Afghan people who come recently, they are professionals. And the degree is not worth the like there is a lot of complicated for them and their family members too. Like what challenges you face and what words do you have for your new family?
Yeah. So just to recap the question for the audience, first I asked about Dr. Kaveh's experience resettling in the US and the challenges that he faced and what advice he would have for refugees as well.
So I didn't come as a professional. I came as a 17-year-old. So I ended up showing up in high school, and Cocoa Beach High School, by the way, in Florida. And I think at the time, I was the only international student. Um, one of the things I remember is I ended up sharing my story a little about the war and the conflict in Iran with this guy who was very nice and quiet. And he literally, after hearing me, he just started walking away. And and he just didn't know how to respond. It was just this, what I was telling him was just, I think was too weird for him. Like, I don't know what you're talking about. I don't think he knew where Iran was, political violence, war. Like, he just, and it made me just stop thinking, for example, sharing this story with anybody, frankly. I just didn't do that. One of the things that helped me in high school was soccer. I played, in Iran, we say football. I played soccer, and that helped me integrate into the high school community. And I would just all of a sudden seen as oh, he's a soccer guy. He's good. He plays soccer. That was it, which it's not a trivial thing. I've seen the same thing happen in New Haven. My kids went to Wilbur Cross High School, and there were some refugees who came and they joined the soccer team, Wilbur Cross. And I saw same thing. They joined the community and their parents will come to watch the kids play, and then the parents start talking to each other. So sports or other things, maybe arts or other activities like that, helps you integrate. Again, I was very fortunate to have an uncle, a physician in Florida, who hosted me. I was able to stay in his house and pay for my college, etc. So these are privileges that I had. Many of the refugees struggle with these things. As I mentioned, refugee resettlement agencies like IRIS have very limited funding support from governments. If they're not able to pay for your tuition, they help you get into, high school, and then you sort of on your own. That's where I feel like the rest of the community needs to do stuff. Refugee resettlement agencies can't help you with your career plans and things like that. I did mention a sense of community. It's going to take a while before you feel comfortable enough. If you're coming from a very different culture, different language, different values, norms, etc., it's going to take a while. So you need something to connect you. And I said, for me, soccer was a key thing. For others, could be music, different kinds of arts. All of those things I think would be helpful. Short answer to your question.
Yes, go ahead.
Question. Now that the United States has pulled its military forces out of Afghanistan, out of Iraq, out of Middle East in general, the United States people were never that interested in that part of the world. And now with the withdrawal of U.S. forces, they're even less interested. How do you think we could spark an interest in the American public to the crises, the mental health crises and the humanitarian crises that exist in those countries?
Great question.
And to recap the question for that, so the gentleman just asking, now that the U.S. has withdrawn largely from the Middle East, namely Afghanistan and Iraq, how will we sustain public interest, American public interest in the Middle East?
I think events like this, frankly, it's about learning about the humanity of people, and not thinking of them as, somebody that's completely different than them. I mean, realizing that those people we're talking about, they have kids, they want their kids to go to school, they want their kids to have a job, they want to have a kind of life that you want to have, you and your family want to have. So I think connecting with the larger community is really the way to do this. That's why I mentioned I'm very pleased that Iris had started this community co-sponsorship program. I think that's a very smart thing to do. My understanding is in Canada, the refugee resettlement happens entirely by the community. They're not like official resettlement agencies that are kind of get money from the government and do this. The way it works is the community steps up and then government supports communities to host them. I think that's the way to do this. So they get to know, oh, what does it mean to be an Afghan or a Syrian or Iraqi? And you get to know them and then you see the humanity in them. So hopefully that will make you have very different mindset or thoughts and yeah, not go with the, horrible narrative that you see sometimes on social media in terms of blaming these people for all kinds of things, from bringing drugs to the country, to bringing violence, to bringing infectious disease, blah blah blah. And there's no data or evidence on that, but it's just, yeah. So I think community events like this are really essential.
I've done some work in Canada, and they do a better job of letting refugees and people from other countries continue their culture. In the States, we're very American oriented. We want to make people into Americans right away. So it seems to me that there's a role for our educational system to play to really sort of welcome refugees and their culture and to allow people to talk about and to share their culture with those people so that it won't just disappear. They won't keep Americans being there.
That makes great sense. I mean, look at this amazing place, Havenly. I mean, the kinds of food that we are now able to access. I mean, it's unbelievable. If it wasn't an organization like this, we wouldn't get it. They're giving us an amazing diversity of food, beans, etc. It's making us.
Go ahead. Okay. I don't know how far.
Join us on stage.
Yeah.
Oh, wow. Okay. Hello, doctor. I wanted to first thank you for coming and introduce myself. So my name is Muna. I'm a student at Southern, along with, oh, louder. So that's my issue. Okay. Is it on?
Yes.
Yeah. But that's just for Zoom, so you have to speak
Oh, I'm
loudly.
so sorry. Okay, got you. Okay. So I wanted to thank you for coming. And I was saying that I'm a recent graduate at Southern. I went to school with Rachel and Razan, and I studied public health. And I'm actually a incoming MPH student in candidate at in epidemiology. So I wanted to ask you in front of the audience how you got your start in public health, because it's kind of like a question I typically like to ask public health professionals. And also I know they mentioned war and conflict, and I wanted to ask you if that had an impact of you pursuing the profession.
Okay. Mention it or
Yeah, so kind of just to recap, she kind of wants to know what it was that made him get into public health, and if like the war and conflict had any particular impact.
So I come from a family of physicians. My mother, a retired pediatrician, sitting right there. My father, who's passed away, was a dermatologist. So I was thinking of medicine. And my uncle's physician, my uncle on both sides, my mom's side and dad's side. So I definitely came from a family of physicians. And I was thinking of medicine, frankly. And then I started getting interested in social science. I started thinking about sociology, anthropology, and I actually, my father was the one who mentioned something to me about public health, and I didn't know much about it on it. An undergraduate, I was a biology major, and I started sort of looking into public health, and this idea that you're not just working with the individual, one person at a time, you're thinking of communities, a neighborhood, a city, a country. That was fascinating to me. And also the prevention focus. Public health has a population level perspective, and it also very much focused on prevention. And I just thought that was really interesting and brought my interest in medicine and in sort of social science together. Um, my father mentioned something about when in Iran, as in many other countries, there's mandatory military service. So he had to, as a doctor, he had to go to military for 2 years. But because he was a doctor, they asked him to, for example, roll out vaccination in villages. And he was mentioning to me how when he went to do this, first he had to engage with the village leaders, explain what is this vaccine, why are they bringing it to vaccinate their children, etc. And he kind of explained to me, we had tea with the community, like before we rolled out the vaccines, we had this conversation with community leaders. And he kind of said, if we hadn't done that, then they wouldn't probably take our vaccine. And I was so fascinated by that, which, by the way, I'm sure you all know, now that we're dealing with COVID-19, that same thing is happening now. Just because we have effective vaccine doesn't mean it's going to solve the problem. We need to build community trust. We need to be transparent, honest about potential side effects, etc. We need to engage with the community to accept our intervention, in this case, vaccination. So when he kind of gave me that example, I was really interested in that. I'm like, wow, that is fascinating. So I decided to, I was pre-med, I dropped and I went to public health. And I came to Yale to get an MPH. And then I continued PhD and postdoc and joined the faculty. In terms of war and conflict and its effect on public health, as I mentioned before, that was not really, or at least it wasn't the immediate reason why I went into public health. But then years later, when I had a sabbatical, which is another wonderful opportunity and privilege for a faculty, I had a year to kind of let go of my teaching responsibilities, administrative duties, and spend time on what I'm interested in doing. I said, this is an opportunity for me to go to a place that I've been neglecting, which is war, conflict, and the role of public health. And I decided to go to Lebanon, where I was connected to colleagues at the American University of Beirut, which is a fantastic institution, top tier institution in a humanitarian, context. And I learned a lot from being on the ground, talking to humanitarian organizations, talking to academicians who were working on health issues among displaced people. So when I came back from that opportunity, that sabbatical, I decided, all right, I'm going to pivot my research. I wasn't going to just let go of all my HIV/AIDS research, substance use research, but I wanted to bring a humanitarian context to that. So I'm still working on HIV-related research in Lebanon, substance abuse-related research in Lebanon, and other things. But humanitarian crisis has become kind of my focus.
Any other questions from the audience?
Last question. We're in the middle of crisis here, public health crisis. Right. We've been in the middle of it now, for more than a year and a half or so, 2 years. How do you think the present administration, the Biden administration, is handling this public crisis?
So the question was, we're currently in a public health crisis, the pandemic, and the gentleman just wanted to know how Dr. Kaveh believes the Biden administration is sort of handling the crisis.
Well, I certainly think the Biden administration doing a better job than the Trump administration. But there's still much work to be done. I mean, the fact that over 800,000 people have died of this epidemic in this country and the pandemic globally, it's devastating. The numbers in some countries are far, far, far lower than that, including China. where this problem seemed to have originated from. I mean, that's a whole other conversation about approaches. I've had the pleasure of working with a student over 14 years ago from a small Himalayan country of Bhutan, which some of you may know about in the Himalaya region. And this student now has become the Minister of Health in Bhutan. And Bhutan is a pretty low resource country. They have very limited capacity, doctors, nurses, et cetera. They actually don't even have a medical school. They send their students to neighboring countries. But if you look at what Bhutan has done with COVID, it's been remarkable. They were able to vaccinate over 70% of their population in a matter of weeks. And by the way, they have no vaccine infrastructure. So they got the first dose from India, the neighboring country, and second dose from US.
Do they
Well,
mandate it?
what's that?
Do they mandate that people taking?
What they did was there is incredible trust uh, with the government. The which is the big difference between Bhutanese culture and culture here. When the Minister of Health or other leadership of the government says, here's what we want to do, and this is why, overwhelming majority of people accept that. They trust the government. They trust what they're saying. That's not the case here. And it's also not the case in places like Iran, where government lies about too many things too often, loses the trust of the public, which creates a major issue because then when the public health people who are honest, evidence-based, they step up, unfortunately, many people ignore them because they don't trust the overall government. Government lies too often, too many times about, so it becomes much more challenging. So I've learned a lot from looking at what my colleague in Bhutan has done, but also there's a religious component to that. Bhutan is a very religious community. They're a Buddhist community, and everything, including when vaccines arrived from United States to Bhutan, I saw a WhatsApp video from my colleague, and there was like a religious ceremony to open up the vaccines and distribute them. So that's the way the society functions. So yeah, we are learning a lot from this pandemic, particularly the importance of transparency, honesty, and building trust with the community engagement. We have unbelievable expertise, resources, the vaccines, etc. But still 800,000 people died. Uh, I hope we learn from this pandemic and do a much better job for the next one.
Here in Connecticut, we're very fortunate because our political leaders have been very straightforward right from the start. And have encouraged people in a very sort of non-compulsory way, just do the right thing for themselves. So we're kind of fortunate here to have the political leadership that we do have.
Yes, Connecticut has done a much better job. I agree. So hopefully, other states learn from what lessons we learned.
And when the government doesn't do a great job of like cultivating this trust, do you think it like becomes the burden of public health officials then to do that work? Or how do you even, as like that's not necessarily your field, how do you feel you have to navigate that?
Great question. I think it does. Because we need that. We need the trust. We need, but I think there are things we can do. We need to do much more community engagement. If you're going to roll out vaccines or testing or whatever it is we want to do, you need to first engage with the community and explain what is going on. Why are we doing this? Um, Years and years ago, as many of you I think already know, even though the HIV/AIDS pandemic has been around for over 40 years, we still don't have a vaccine. I remember maybe 15 years ago or something, I watched the video. There was a HIV vaccine which was being rolled out, and there was like a community event, and these researchers were talking about the vaccine and how they wanted to get it out there, etc. And I remember one of the participants asked a very simple question from the analysts, who are all researchers, saying, would you give this vaccine to your child? That's a very personal question. And, and I noticed the researcher was very nervous. They couldn't answer it. I was like, oh, you should be able to answer that question. If you're asking the community to take this vaccine, you got to be able to, show whether you're comfortable with it. They asked a very personal question, and the person really had a hard time answering. And I don't think he answered it, frankly. So yes, the public health community also needs to do as much engagement as they can do with the community and build the trust. But of course, we are somewhat burdened by what the top level leadership, the government, does. If they put out misinformation out there, or then it makes our job a lot harder.
Great. Thank you so much, Dr. Kaveh. Are there any other questions from the audience? Okay. In that case, I think we'll end here today. Thank you so much, Dr. Kaveh. It was great to hear about all of your research experiences in Iran, Lebanon, and Afghanistan, and to really just hear you articulate what it means to be a public health official, working in the Middle East and working during this time when we're in a pandemic. And it's also, we have to thank, Havenly for hosting us and, really taking the time and effort to highlight refugee voices and refugee stories and narratives. So thank you so much, Dr. Kaveh.